today I'm going to be talking about the benefits of medicinal marijuana for pain management. My name is Jordan Simpson, and I am a senior athlete training major at the University of Non-Union, and this is the video for my capstone presentation. First, my research question was, will legalizing medicinal marijuana in the United States reduce pain in cancer and in other terminal illnesses? I chose this question because I was very interested in the topic of medicinal marijuana and how widespread it is getting within the United States, and I wanted to kind of be up to date with it because I usually fall off the trend and never really keep up with any updated things in the US. So first I'm going to start out with a video. I was very confused with the differences between medicinal marijuana and recreational marijuana because I was not up to date on the topic. So this video did help me out, and it's just like a short 2-minute clip.
Marijuana, or cannabis, also known as the stoner drug, is known for getting people high. But did you know that it's legal in 8 states for recreational use? It's legal in 20 states for medical use, and it's illegal in the remaining 22 states. Now, most people consider marijuana as bad as cocaine or heroin. But did you know that marijuana has many reported health benefits, backed by both science and research? Marijuana contains 2 key ingredients. The first is a psychoactive ingredient that causes the high effects. It is known as tetrahydrocannabinol, or THC for short. This is the main psychoactive ingredient of marijuana. THC attaches to cannabinoid receptors in the brain that include thinking, memory, sensory, and time perception. This is how THC plays a role in the psychological effects you may have while under the influence of marijuana. THC has also been used for its pain-relieving effects. A study published in the Journal of Pain and Palliative Care Pharmacotherapy suggests that THC activates pathways in the central nervous system which work to block the pain signals from being sent to the brain. A pilot study published in Clinical Drug Investigation talks about how THC can be helpful in post-traumatic stress disorder. Because of its psychological effects on the brain, it has been therapeutic for some patients who suffer from flashbacks, agitation, nightmares, and other symptoms of PTSD. Another component of marijuana is the non-psychoactive ingredient that is called cannabidiol. It reduces the effects of THC, in other words, works against the high effects. CBD is thought to be responsible for turning off a gene by the name of ID1, a protein coding gene that is suggested to help cancer cells spread throughout the body. Studies published in the journal Molecular Cancer Therapeutics suggest that cancer cells produce more copies of these genes than non-cancer cells. Some anecdotal cases also show us that marijuana may be helpful in treating epilepsy, although this is yet to be comprehensively studied. But in the case of 8-year-old Charlotte Figge, the use of marijuana that was low in THC but high in CBD has reduced her 300 seizures a week to just 1 seizure every 7 days. So, marijuana has other applications, other than just producing the high effect. Are there any other science issues or phenomena you'd like us to explain? Let us know in the comments below.
So like I said, that was just a short clip that helped me kind of understand a little bit about medicinal and marijuana and the differences, and especially the differences between the active ingredients within the drug. So first, the background. Like I said, I wanted to do this research because I was interested and I wanted to stay up to date on what was going on in the U.S. I didn't realize it was so long ago that the first state legalized medicinal marijuana. I have never really been up to date on it, but since it's becoming more frequent and I can't go through one town anymore seeing CBD shops, I wanted to kind of understand what was going on and what CBD even really was, because I've never really paid attention to any of those things. So I believe that my research paper and presentation will educate readers who are uncertain about the differences between medicinal and recreational marijuana, also the health risks and benefits that medicinal marijuana can produce, It will help fill the gap in research because there were a lot of different scholarly journals and articles that I found that provided evidence for this research. It addresses why it is an acceptable medical treatment. It explores the different types of treatment and prescriptions that physicians can give to you. And I believe that it is important for all medical professionals and U.S. citizens to stay up to date on this because it is a worldwide thing going on, and it does affect everybody on this earth. Next is my introduction. So marijuana does have 100 different chemicals and 500 natural elements within the plant, but the most important two are what he's already stated, THC and CBD. THC is what is known to produce the high effect. So the psycho part of the drug, it affects your brain more than anything. Like, it's not really the part that helps with pain, it just affects the brain. That's how I like to think of it. And then CBD, on the other hand, is the beneficial part because it decreases pains and symptoms in other diseases and conditions, like he stated before, post-traumatic stress disorder. So people who have a lot of anxiety or things going on up in their brain that they just can't release the stress of, and seizures and epilepsy. It helps with all of those. It helps reduce the pain and the effects and symptoms that are provided with those conditions. And then the main difference between the two are that medicinal marijuana has more CBD in it than THC, so you're not getting a lot of the euphoria stage that you would be getting if you just smoked recreational marijuana. Stated by the National Survey on Drug and Health Use, it is estimated that 2.7 million people 12 years or older are dependent on marijuana, whether it be smoked, in edible form, anything. They are dependable. And the sad part is it's 12 years or older, and this is not medicinal marijuana. It is recreational. So if we turned marijuana into a healthier version, which would be medicinal, are we going to get the negative effects that we get with recreational instead of just medicinal marijuana, where you get more benefits than adverse effects kind of things? So next is a little bit about the history. So the first known use of medicinal marijuana was in China in the year 2737 BC by Emperor Shennong. Also, in 1850, the cannabis was added to our U.S. pharmacopoeia, which is the book that has every single prescription known to man in it. If it does not have it, it is not a drug. You are not allowed to prescribe it in the U.S. So it was introduced to that in 1850. Next was the Marijuana Act, which was activated in 1937, so it was legal. And then in 1942, it was then removed from the U.S. pharmacopoeia, so it was no longer a prescribable drug. Doctors were not allowed to prescribe marijuana, and this wasn't medicinal marijuana that they were prescribing. They were prescribing recreational because there was no such thing as medicinal yet. And then between the years 1841 and 1951, marijuana was a prescribable drug. So between 1850, like I stated, and then 1942 is when it kind of fell off the charts. And then, like I said, how long it has been that I did not know when the first state legalized medicinal marijuana. It is 2019, and the first state was California in 1996, and I never knew that that was a thing. So it has been a very long time, and I'm very behind until now. So these are all the states that are legalized medicinal marijuana currently. There are 38 states, so we have 22 states who are currently still illegal for medicinal marijuana, but you will still see the CBD stores throughout the states that don't have it because it's not prescribed through a physician. It's just a medical card, and you can get medical cards just about anywhere nowadays. So the 38 states were stated by Goldenberg in 2019, so this is an updated chart. There are 38 states that now are legalized for medicinal marijuana. Next, I'm going to explain a little bit of the difference between THC and CBD. So THC does ease a little bit of pain, but it's more due to the psycho part that it's doing to your brain versus just naturally relieving the pain. it helps you relax. So that's a little bit of the high stage. And then it does suppress pain for nerve damage, and it reduces your risk of nerve damage. And then it suppresses muscle spasms and convulsions, so you don't have muscle spasms as frequently or really at all if you are suffering from that. THC is what you need. And then CBD reduces your risk of seizures. As he stated in that video, there was a trial done on a child who had seizures 300 times a week. So 300 seizures in 7 days. And after he took medicinal marijuana, which was high in CBD and low in THC, it lowered his seizures to 1 a week versus 300 a week. So it does show very beneficial things in not only pain, not only cancer patients, but other disorders and conditions as well. It also kills cancer cells and stimulates bone growth, so it prevents osteoporosis and the brittling of bones as we age. And it's also an anti-inflammatory, like ibuprofen and Aleve. You take those if you're kind of having swelling within joints or pain in joints. And it's also an antipsychotic, so you don't get the high or the euphoria stage with CBD. That's only THC. So next we're going over the schedule of drugs. So a schedule of drugs is within the U.S. Pharmacopoeia. It is the ranking of how abusable a drug is versus how low the abusable the drug is. So Schedule 1 is the most likely abused drug. So those are drugs like cocaine and heroin. So if you start it, it's hard to stop it type thing. That's what Schedule 1 is. It has a very high potential for abuse. Schedule 2 goes lower. So you're moving down the grade versus up. So it's decreasing as we go down. So Schedule 2 is a high potential for abuse and potential leading for severe psychological and physical dependence. But the drug does consider dangerous, but it's lower than cocaine and heroin. And then drug 3 is moderate to low potential for abuse. And then Schedule 4 is low potential for abuse and low risk for dependence. And then Schedule 5 is your last schedule, which is a low potential for abuse. And like I already stated, those are your Aleves and ibuprofens. Those are things that you don't have to wake up every morning and take. You just choose to take them if ands or buts, if you're having a little bit of pain here and there every day. So going off of the schedules, we have a few drugs that are cannabinoid drugs. And the first one, the generic version, is called Casamint. It is a Schedule 2. So it is a high risk of abuse. So the doctors only prescribe a small amount of capsules when they prescribe this drug to people. They do not give them 30 and 60 and 90-day tablets to take one every day. It is something small that you can take here and there. If you take it every day, then you will be dependent on it and you will abuse the drug. And a couple ways to figure out if people are abusing drugs is if they are upset if the doctor is taking away their medication from them. So they are showing signs of like, no, you cannot take my medicine away from me. That is one way that you know that they are dependent on the drug. Or also if they aren't getting the effects that they were getting before. So if at first they were like, yeah, this is really helping my pain. And then 3 weeks later, they've taken 21 capsules, so 1 a day or 2 a day maybe, and they're like, no, this is not helping at all. I need something stronger. Then that kind of shows that they build a tolerance to it, that they're taking it too much. So those are 2 ways that you can determine if somebody is abusing drugs or dependent on drugs. And then the last drug that has a cannabinoid in it is a Schedule 3, and the generic name is Marinol. They are both treated with patients with cancer. So cancer patients will be most likely the ones to be prescribed these drugs. And they treat nausea and vomiting, which are most likely seen in weak cancer patients. But Marinol is also provided to patients with AIDS to help with anorexia and weight loss. So when you have AIDS, you don't eat as much and you're losing a lot of weight. When you take this, it builds up your appetite, and obviously when you eat more, you put a little bit more weight on. But But other than that, they both treat the same exact thing, so physicians will more likely prescribe the Marinol because it is a Schedule III drug versus the Casomet because it is a Schedule II, so it's more likely to be abused. And then the adverse effects and risks for the drugs. So adverse effects for drugs is what you are going to feel that's not right with the drug. So kind of like reasons why you wouldn't want to take it or why you shouldn't take it. So you will get a headache and drowsy/sleepy when you take medicinal marijuana because of the little amount of THC in it, and you can experience dizziness, the feeling high sensation, short-term memory loss, a lack of coordination and weakness within your body, dry mouth, which means increased thirst, so you want to drink a lot all the time, and then trouble concentrating. And then the risks for these are you could get lung cancer. So if you are smoking medicinal marijuana, it's just the same as smoking tobacco and vaping and juuling. So you can increase your chance of getting lung cancer as well. Third, like I stated before when we were going over the two pill forms, they are addictive drugs. You have a potential to depend on them, and you can abuse those drugs. So you have a risk of being addicted to pill forms. It also may lead to patients doing other drugs. So like I said, with a dependence, if they grow a dependence on that and a tolerance, if they're not feeling like they are getting out of the drug what they should be getting out of the drug, they may result to higher abuse drugs. So cocaine and heroin, things like that. So they might do drugs that make them feel better, and then they might grow a dependence for that too, and then you're stuck in a whole different sticky situation. And as a physician, that's not what you want to see for your patients, them getting addicted to your medicinal marijuana and then going to higher things and then maybe overdosing. You do not want to see that for your patients. And then lastly, it does impair your cognitive function. So like I said over here, an adverse effect is trouble concentrating. It is a long-term effect. So you can lose your cognitive impairment. You can have a lot of trouble getting out of bed in the morning. You can have a lot of trouble like paying attention in class. So if you do medicinal marijuana in class, before class, I would suggest not to do it because you don't pay attention and you lose your cognitive awareness. Like, then we're learning nothing here. And then my conclusion for this is medicinal marijuana and the prescriptions that we went over that include the active ingredients within marijuana are provided to help, like, decreasing pain in cancer patients, decreasing symptoms from chemotherapy, which is the nausea and vomiting, which the pill forms help with, and then reducing the risks and suppression pain from nerve damage. So you can get nerve damage with just about any condition or disease, and it helps reduce the risk of that as well. So it benefits nerve damage and cancer patient pain. But after conducting this research on this topic, it provided evidence that medicinal marijuana should be a form of treatment for pain management, especially in the terminally ill patients, because it is the strongest clinical evidence in support of cannabinoids they appear to be for cancer patients. And that was stated by Fisherman and Kim in 2017. So a lot of journal articles and academic articles that were written were mainly based on cancer patients, the benefits that it does for pain management in cancer patients. So after my research, I did find a lot of information that proved that medicinal marijuana will benefit pain management in cancer patients. And these are my references. Thank you.